friends, today I am going to read radius. The radius is the lateral bone of the forearm and is homologous with the tibia of the lower limb. It has an upper rounded end and a lower broad end with a styloid process and a shaft. Side determination: upper end is having disc-shaped head, a narrow neck with lower end is expanded with a styloid process. Close to neck, it represents a radial tuberosity. At the lower end, the anterior surface is in the form of thick prominent ridge, while the posterior surface presents four grooves for the extensor tendons. Lower end represents a tubercle on the posterior surface called a dorsal tubercle of Lister. The sharpest border of the shaft is the medial border. Features: upper end. The head is disc-shaped and is covered with hyaline cartilage. It has a superior concave surface with articular with the capitulum of the humerus and the lower elbow and at the elbow joint. The circumference of the head is also articular. It fits into a socket formed by the radial notch of the ulna and at the annular ligament, thus forming the superior radio-ulnar joint. The neck is enclosed by the narrow lower margin of the annular ligament. The head and neck are free from capsular attachment and can rotate freely within the socket. The radial tuberosity lies just below the medial part of the neck. It has a rough posterior part and a smooth anterior part. Shaft. It has three borders and three surfaces. Borders. The anterior border extends from the anterior margin of the radial tuberosity down close to the styloid process. It is oblique in the upper half of the shaft and vertical in the lower half. The lowest part is sharp and crest-like. The oblique part is called the anterior oblique line. The posterior border is the mirror image of the anterior border but is clearly defined only in its middle one-third. The upper oblique part is known as the posterior oblique line. The medial or interosseous border is the sharpest of the three borders. It extends from the radial tuberosity above to the posterior margin of the ulnar notch below. The interosseous membrane is attached to its lower 3/4. In its lower part, it forms the posterior margin of an elongated triangular area. Surfaces. The anterior surface lies between the anterior and interosseous borders. A nutrient foramen opens in its upper part and is directed upwards. The nutrient artery is a branch of the anterior interosseous artery. The posterior surface lies between the posterior and interosseous borders. The lateral surface lies between the anterior and posterior borders. It shows a roughened area in its middle part. The lower end. The lower end is the widest part of the bone. It has five surfaces. The anterior surface is in the form of a thick prominent ridge. The radial tuberosity is palpated against this surface. The posterior surface presents four grooves for the extensor tendons. The dorsal tubercle of Lister lies lateral to an oblique groove. The medial surface is occupied by the ulnar notch for the head of the ulna. The lateral surface is prolonged downwards to form the styloid Greek pillar process. The inferior surface bears a triangular area for scaphoid bone and a medial quadrangular area for the lunate bone. Triangular area for the scaphoid bone and medial quadrangular area for the lunate bone. This surface takes part in forming the wrist joint. Attachments. The biceps, Latin two heads brachii, is inserted into the rough posterior parts of the radial tuberosity. The anterior part of the radial tuberosity is covered by a bursa. The supinator, to bend back, is inserted into the upper part of the lateral surface. The pronator teres is inserted into the middle of the lateral surface. The brachioradialis is inserted into the lowest part of the lateral surface just above the styloid process. The radial head of the flexor digitorum superficialis takes origin from the anterior oblique line and the upper part of anterior border. The flexor pollicis longus takes origin from the upper two-thirds of the anterior surface. The pronator quadratus is inserted into the lower part of the anterior surface and into the triangular area on the medial surface of the lower end. The radial artery is palpated for radial pulse as it lies on the pronator quadratus medial to the sharp anterior border of the radius, lateral to the tendon of flexor carpi radialis. The abductor pollicis is longer and the extensor pollicis brevis arise from the posterior surface. The quadrate ligament is attached to the medial surface of the neck. The oblique cord is attached on the middle side just below the radial tuberosity. The articular capsule of the wrist joint is attached to the anterior and posterior margins of the inferior articular surface. The articular disc of the inferior radio-ulnar joint is attached to the lower border of the ulnar notch. The extensor retinaculum is attached to the lower part of the sharp anterior border. The interosseous membrane is attached to the lower 3/4 of the interosseous border. The first group between the sharp crest-like lowest part of anterior border and styloid process give passes to abductor pollicis longer and extensor pollicis brevis. The second group between the styloid process and dorsal tubercle give ways to extension carpi radialis longus and extension carpi radialis brevis tendons. The third oblique group medial to the dorsal tubercle give passes to extensor pollicis longus tendon. The fourth group on the medial aspect give passes to tendons of extensor digitorum, extensor indicis, posterior interosseous nerve and anterior interosseous artery. In addition, at the junction of the lower end of radius and ulna, fifth group give passes to the tendon of extensor digiti minimi. Lastly, in relation to ulna between its head and styloid process is the sixth group transversed by tendon of extension carpi radialis. These are 6 compartments groups under extensor retinaculum of wrist. 4 are in relation to radius, 5th at the junction of radius and ulna, and 6th on the ulna itself between its heads and styloid process. Ossification. The shaft of radius ossifies from a primary center which appears during the 8th week of development. The lower end ossifies from a secondary center which appears during the 1st year and fuses with shaft at 20th year. It is the growing end of the bone. The upper end head ossifies from a secondary center which appears during the 4th year and fuses with shaft at 18th year. The radius commonly gets fractured about 2 cm above its lower end, Colles fracture. This fracture is caused by a fall on the outstretched hand. The distal fragment is displaced upward and backwards and the radial styloid process comes to lie proximal to the ulnar styloid process. It normally lies distal to the ulnar styloid process. If the distal fragment gets displaced anteriorly, it is called Smith's fracture. A sudden powerful jerk on the hand of a child may dislodge the head of the radius from the grip of the annular ligament. This is known as subluxation of the head of the radius, pulled elbow. The head can normally be felt in a hollow behind the lateral epicondyle of the humerus. Thanks.